Good evening and welcome to the Betty Irene Moore School of Nursing at UC Davis DNP-Nurse Anesthesia degree program information session. My name is Catherine Leva. I am part of the admissions team here at the School of Nursing. I just want to thank you all for taking time out of your very busy schedules to learn more about who we are at the Betty Irene Moore School of Nursing at UC Davis, but also our DNP Nurse Anesthesia program as well. And for the next hour, we will highlight a little bit more about what is unique about our school, why you might choose our DNP-NA program for your advanced degree, and what makes our program unique. You're going to be hearing from some of our amazing DNP-NA faculty and also from the admissions team today as well. We will also have a Q&A at the end. All right, so I did a little bit of welcome. I'll do introductions on the next slide, but again, we're going to be going over our school and our program, and that's with Dr. Brian Toon and Dr. Terrence Burrows, who is joining me today. You're going to be hearing from them in just a minute. And then my colleague, Amanda Yee, will be going over the admissions requirements process and things like that. And as I said, at the very end, we'll have a Q&A as well. I do see a lot of hands being raised. So again, please use that Q&A feature and we will definitely try to answer them throughout today's presentation and then at the end as well. Okay, so before I introduce my DNP-NA faculty, I want to introduce my colleague, Amanda Yee. She's our admissions and recruitment specialist. She specifically works with the DNP-NA program. So you probably will be hearing from her if you haven't already heard from her at some point. So anytime you email in questions, it's probably going to be her or even myself who will be assisting you. But now I will hand it over to Dr. Brian Toon and Dr. Terrence Burrows to introduce themselves and take it away.
Hi, good afternoon, everyone. Thanks so much for joining. We're really excited to have this online recruitment forum, tell you all about our great program. And I think by the end of the hour, you'll see really what an amazing institution we have and an amazing program. I come to UC Davis after 16 years of higher education. I am a dual certified, board certified family nurse practitioner and CRNA. I practice in both roles, but my foci is really in nurse anesthesia education. I've been involved in nurse anesthesia education, like I said, for the last 15 years, former program director and a site reviewer around the country. So the team that is recruited into this program is second to none. And I think we'll tell you a little bit more about that. The faculty and the administration that exists in this program is next level. So thanks for sticking with us for an hour. We're looking forward to hearing all of your questions. We're an open book and excited to answer those for you.
Hi, everyone. Welcome. Congratulations on taking the first step of your new exciting career. We're excited to have you here and look forward to having you here, students. I am a nurse anesthetist. I've been a nurse anesthetist for 20 years, RN for about 30. Have 10 years in education. I was a previous program director and assistant program director at other programs. And been in the Army Reserve 22 years as a CRNA. And just reinforce what Dr. Toon said there. You've made a really good choice picking this program. Our philosophy, our dedication to the profession, and the quality of faculty we have managed to recruit is second to none. And that enables us to give you an excellent educational experience. So long.
Dr. Burrows, Dr. Toon, do you want to speak to a little bit about why Betty Irene Moore?
Yeah, I'd love to.
Sure.
So I'm super excited about it. And really, the program and all of the resources within the program speak for itself. Stepping foot on campus, you see the commitment to nurse anesthesia and advanced practice nursing. So the vision within the Betty Irene School of Nursing is optimal healthcare and equity for all. And that resonates throughout the program. Equality, diversity is very, very important. And you'll even see that in our application process. And you see our written mission here, and it's really focused on innovative research, education, practice. And within the program level, we are 100% committed to full practice, independent nurse anesthesia education and giving graduates the opportunity to choose where they want to go. So it may not mean a lot to any of you at this point about independent versus team this point, but we give that opportunity and that education to provide both to allow you to be successful at the end of it. And so to do that, we're really focused on that mission of transformative research. That dovetails into your scholarly project. And it is our goal that we have high level, functional scholarly projects. That's actually one of my areas within the program. And so we want these to be meaningful project program projects that come out of the program, really changing the way that we do things in institutions. We want to provide and educate all healthcare professionals, but specifically within this program, we're looking at advanced practice nurses in anesthesia. We want to look at making effective system change and then influence policy. So within the program, we do follow the standard curriculum for the DNP and the foundations for the DNP. And part of that is policy education. Business and policy runs healthcare. And so we believe very strongly in providing you that foundation and doctoral level education in that. And then advanced health from multiple settings. And as Dr. Burrows is going to tell you about, we have a humongous pool of clinical education. He's been out all over the country, but specifically here in the state of California, recruiting really some of the best clinical opportunities that exist in this state so that we do have a diverse training population for our graduates. The advantages being that this is the first DNP at UC Davis, and the rotation opportunities will be obviously at UC Davis Health, but so many other affiliates that are combined with that. So we do have the beauty of the on-campus UC Davis Health, but then so many other clinical opportunities for our students. So it is not the case that they are only in one institution. So I want to be very clear about that. Next slide.
Okay,
So
so
go
go
ahead.
ahead, Brian. I'll go ahead and talk a little bit, give Brian a rest. So this is basically just the overview of the program. Uh, we got we went through an accreditation process. That's quite an intense process where you got to do a self-study, and that's basically the Council of Accreditation. Look, come visit the program, evaluate your resources, and to see if you have the adequate resources in order to run a nurse anesthesia program. And we got an excellent on-site review. They were very impressed. So we had absolutely zero issues with our accreditation process. That led us to being accredited January 22nd, 2025. We matriculated our first class this June. That was 16 students. We actually approved for up to 30 students. But with any new program, you start small and you build slowly. Well, the admission cycle for this year opened August 7th and it closes early November. Can't remember the exact date. Maybe someone can help me with that. But I know the the application cycle closes in early November.
November 1st.
November 1st, okay. So hybrid program, the advantages of a hybrid program. This is quite new type of education for entering the practice nurse anesthesia programs. It's pretty established for those CRNAs with a master's degree going to get their doctorate. Those were mostly online. For the hybrid program, the advantage we have with the hybrid program is all the classes you will do will be online. Synchronous for the anesthesia classes and asynchronous for the core classes. The advantages for that is it's cheaper for students. You get to stay where you live and do your education from there. It also helps the program in clinical placements. When we have our education online, we can send you to a clinical rotation in Texas. We can send you to a clinical rotation in Arizona. We can send you to a clinical rotation in Southern California. That really opens up our options to give you excellent clinical experience. As Dr. Toon pointed out, we're we're deep in the process of establishing excellent rotations nationwide. You will have access to faculty advisors and instructors. You'll be assigned a faculty advisor when you start the program. That person will stay with you for the entire 3 years. You'll meet with that person once a quarter at least, and more if you need to. In quarter 3 and quarter 5, you will come to campus 1 to 2 days a week for simulation education. Now, simulation education is incredibly important. That's where you take your didactic experience and you start applying it to clinical practice using mannequins and other forms of technology. We have a very extensive program established. Dr. Sararak, was instrumental in setting the simulation education syllabus up at Samuel Merritt University. Dr. Toon and I, we set up and ran the simulation and the anesthesia program at National University for many years. That's where you start making that sort of transition to getting ready for clinical. So you'll do basic simulation 1 to 2 days a week, quarter 3, campus 1 to 2 days a week. Quarter 5, you'll do the same. Quarter 5, you'll do advanced simulation. For the basic simulation, you learn basic airway, you learn how to position a patient, how to do a general anesthesia from start to finish, how to put in a spinal epidural. In quarter 5, we start doing high-level crisis management, where we're doing crash C-sections. You'll be doing codes in the OR, and thoracic anesthesia, where you learn how to collapse a lung, and all the fun stuff you will need to be successful at clinical. We're in the process of buying state-of-the-art equipment for regional anesthesia. And we'll be having a seminar during your training, which I believe Dr. Toon will be heavily involved in. He's nationally renowned for his regional anesthesia skills. So you're going to have a really good experience with the quality of the faculty, integrated with the simulation education, and then you go straight in from that in quarter 6 into your first clinical rotation. You start your clinical rotation in quarter 6, you'll be there 3 days a week. You'll have 2 days where you'll be doing classes and your DNP project. Quarter after that, you go up to 4, and then the third year, 4 to 5 days a week. I'll let Dr. Toon talk about the scholarly project. That's going to be, he's going to be in charge of that part of the syllabus. Have you anything to add to there, Dr. Toon?
Yeah, scholarly projects, we start the early phases of that in year 2 and finish that up in year 3. As I mentioned, the scholarly project is really part of that doctoral component. But I think it's very important that we understand and potential students recognize that we want those to be meaningful projects that are anesthesia focused. So we're not interested in basic run-of-the-mill things. We very much want it to be meaningful, but at the same time, we are hyper focused on this being a clinical practice doctorate. And so we are committed to the clinical training of the student. And so we have a very fine balance, and the curriculum is laid out such that the project doesn't overshadow your clinical training, because we're creating cRNAs here. Is research important? Yes. Is it part of the mission and vision? Yes. But at the end of the day, we are training clinicians, and that's what we are 100% committed to. So I dance around that delicately to tell you the project is very, very important, but don't take it lightly that we dismiss a level of the clinical education. It's full speed in year 2 and 3 in regards to the clinical education, and that is one of our highest commitments within the program. We can do next slide. So here you have a little curriculum layout. This kind of allows you to understand and see where we are as we march through. We're a quarter system process, so those move quickly. If you haven't been engaged in a quarter system model, you identify rather quickly that the quarter system advances very quickly in that 12-week process versus a 16-week semester. So we start in the summer and we move all the way through. So this is a 3-year, all the way through program as a practice doctorate. So starting in the summer, you can see exactly what's going on here. There's chemistry and physics. For those that don't come into the program with a master's degree, which is a lot of students, if not most, there's the post-baccalaureate leadership and innovation, post-baccalaureate research, evidence-based practice, and then the applied informatics. If you came in with a master's degree in nursing, you get to eliminate those and you have a rather light summer as you start. What I can tell you is we plan the curriculum very strategic so that as you come in on that summer quarter, we understand many of you have been away from academics for quite some time. Moving into the rigor of academics can be challenging. And in our hybrid model, where we're using a lot of online course delivery with hybrid facilitation, that takes a little bit of time too. So we give that to you. And in that summer, those courses aren't wildly rigorous, so they're quite manageable. They allow you to transition in real nice and kind of get the groove so that when we get to fall, winter, and then spring again, you're ready. You're ready to do all these. You understand the systems, you understand the process, you understand our methodology and course delivery. And so then fall, you've got your A&P. You start in on anesthesia pharmacology, quality and safety, and then professional aspects. That professional aspects is really teaching you what is a CRNA and how do I behave? What are the politics within the nursing anesthesia world? How do I behave within the clinical setting? And then once I'm out in practice on my own. So it really kind of sets the tone for how you march forward in the rest of the program. Patho, Pharm, and Principles of Anesthesia all come in that winter quarter. Students really love that because now you're in 100% the meat and potatoes of anesthesia. That's a rigorous quarter there. And there's also the basic simulation where we start in there. Dr. Burrows mentioned the simulation center, and I think I should add one more point to that. No expense was spared with the simulation center. It's top notch. There's everything you could imagine. It is a fully functional operating room. So you're not dealing with just low fidelity, head trainers. You've got a high fidelity, multiple high fidelity trainers, an anesthesia gas machine, all the equipment, everything that you would see in a simulated environment, and even in a multidisciplinary team. So that when you step foot into the clinical environment, you may not have touched a patient doing this, but you have worked through the simulated processes, and it's not so abstract and it's not so fearful to you because you know the processes that go through there. And then you can see what we've got going on here in spring. It's the same courses here in the purple. Those are the core NP core courses. Are they anesthesia specific? Kind of. So anesthesia faculty are involved in them, but they're for the broad context of that DNP credential that you're earning. So they look at things in a broader healthcare system, so it's not always specific to only anesthesia, which is a good thing. You're in seat with the nurse practitioners, and so it allows early collaboration between two specialty foci. We can do next slide. So this is year 2, and you can see we're all blue there. So in the summer, it's all anesthesia courses from the third Principles of Anesthesia course, advanced simulation, advanced assessment, and then a chronic pain management course as well. Then fall is the fourth anesthesia principles, and then a case-based diagnostic course. So this is really doing like advanced high-level case studies with some simulation thrown in there, so that we're thinking at a didactic level or a book level, if A happens to me in the operating room, I need to do B. And so it's getting those stepward processes in place for you, because also in that same quarter, we start clinical. And so in that clinical section, you'll be in 3 days, possibly four, but a minimum of 3 days in the operating room. So you have some didactic content and you have clinical. We are a primarily front-loaded program. So as you see, we get all the way through Principles of Anesthesia 4 there, which means prior to walking into the classroom, you have the theory and background. Where in the integrated model, you might be walking into the room and have never heard or never learned how to do regional anesthesia, how to put a spinal in, how to do a popliteal block, or you've never how to do a lung case, but you get thrown into a pneumonectomy. And so that can be very stressful to students. Where in our model, we provide that theory up front and we provide simulation up front so that you at least know how this is going to go down and you have background knowledge in how to do this case. In year 2, winter, we go through the systems and the population health course. You have your second clinical. And then there's a seminar, and the seminars help to tie the clinical together. So that's a lot of discussion. We do case scenarios, we do some quizzing, testing, those kind of things. You'll see as we march through on the next slide in year 3, there'll also be seminars. And tied to each clinical, there is lots of continuous quizzing. So even though in years 1 and 2, we get all of that didactic content up front, we don't abandon you in year 3. So we're still very much on you. We're testing, we're quizzing, we're making sure that you're ready to sit down and take that national exam and pass it on the first attempt. That spring quarter, we've got a little business and then clinical. And here in year 3, this is where you start to see the light. You're like, oh my God, last year I'm getting closer to the end. I get to walk across the stage and actually do this and make money doing it. And you see it's pretty straightforward. This is a down and dirty, a lot of clinical hours. This is 4 and 5 days a week that the students are in clinic. You in the coming slides that the minimum, the Council on Accreditation requires 2,000 hours. But across the country, students are gaining close to 4,000 hours in clinical exposure. So there should be zero concern about you having enough clinical exposure, getting your cases. You're going to be just fine in here. In fact, I think you're going to well surpass the national average in clinical training. So that's our curriculum. We can go to the next slide.
I can talk about this. So as we were discussing earlier, we've got our basic simulations, which is the preamble of going to your clinical rotations. It's actually a lot of fun in the simulation lab. You see students get stressed out, but it's a lot of fun for the faculty. But so you're going to do, as I say, the first in quarter 3, you'll be there 1 to 2 day a weeks. You'll do position. We have different types of procedures we do in anesthesia. In the operating room, I should say, you have your basic supine position for lap chole. But if you're getting spine surgery, you got to learn to intubate the patient, position him prone in order for, and then the entire case is done in the prone position. So you can imagine how bad it would be if you haven't secured your ET tube properly and it pops out in the middle of the OR when the back's got open. You're going to learn your airway management. This is our bread and butter. You're going to learn your basic airway management. I mean, everybody thinks they know how to ventilate a patient until they come into anesthesia. And then they see it's a much more technical skill than they actually thought. You learn about you're using your different airway adjuncts. You learn like just your basic oral nasal airways, your laryngeal mask airways. You learn to intubate. You learn to intubate with the glide scope. You learn to use a fiber optic scope, which we utilize in more difficult intubations. You learn about neuraxial anesthesia. That's code for spinals and epidurals. Do a lot of spinals, epidurals, and obstetric anesthesia, as well as in orthopedic anesthesia. You'll learn the anesthesia machine inside out, back to front, and you'll know every little part of it, every system, what the pressure is inside the machine at different areas. You learn that in your lectures, and then when you come in to the simulation lab, we will show you how to troubleshoot it, how to do it, take it apart to a certain level, and how to do an anesthesia check, anesthesia machine check. That's your basic safety, one of the basic most important safety checks we do in the OR. You learn your basic ultrasound, a point of care ultrasound, arterial lines, central lines, suturing, all that fun stuff. And we have, as Dr. Jim pointed out, they've really spared no expense to get top of the line mannequins for you guys to utilize to learn these skills. And it really is, it makes such a difference going into clinical when you have this kind of education. When I trained, when Dr. Toon trained, we didn't get this. We got a little bit, but nothing like the technology we have now. We are able to give the mannequin, you will be able to push a drug, a simulated drug, actually not a real drug, and we will adjust the vital signs accordingly on the simulation man to simulate the reality of what would happen physiologically with a human being if you push that same drug. So if you push too much of a drug, you get to drop the blood pressure. And then you get to figure out how to bring it up. And all this will be educating you for. This is a place to do it. This is a place to make mistakes. This is a place to learn. And then in quarter 5, before you go out to the real world of clinical, you'll do, as I said, all your emergency anesthesia, all your cardiac emergencies. You're going to have a difficult airway. I mean, I think the most stress I've experienced in life is when you put a patient to sleep and you can't intubate and you can't ventilate. There's nothing scarier. We will try to some success to replicate that amount of stress in the simulation lab to prepare you for the real thing. Because managing your stress is imperative in your ability to manage your anesthesia. If you can't cope with your stress, when you see something that's an emergency, you're not going to perform as well. And we'll try to teach you to control yourself, control your emotions, control that anxiety. The obstetric anesthesia, it's always fun. That'll be mostly spinals, epidurals, and then the crash C-sections. We've talked about crisis management already. That would be your difficult airways, unanticipated difficult airways, your cardiac arrest, you're dealing with a massive transfusion in the operating room and you have to give 30, 40 units of blood products. That's always fun. And then effective team communication. We don't work in a silo. You got to communicate with your surgeon colleagues. You got to communicate with a nurse. You got to communicate with a lab. And you got to anticipate all of this. It's not like in an emergency room where someone comes in, then everyone starts reacting. If you have an emergency situation in anesthesia, which could have been anticipated because you studied the night before, and you know that this type of surgery tends to lose 2 liters of blood, and you haven't prepared by getting the type of screen, maybe getting 4 units of blood, 4 of FFP in the room, that's a problem. But this is what this is for. This is to train you to cope with all these situations you're going to encounter in your clinical rotations. We go to the next slide. Right, so the clinical, as Dr. Chin alluded to with the clinical rotations, clinical is tough. It's, for me personally, it's some of your best days in clinical. Sorry, some of your best days in the program will be in clinical, and some of your worst days will be, especially when you're new. By the time you're getting to the end of it, you don't want anyone in the room with you. You're great, you're good to go, and you're ready to graduate. So that's what we're looking for. So when you initially start clinical at first days a week, you're going to have someone basically in the room with you all the time. By the time you're graduating, they're going to come with emergence, maybe come at the end. And that'll be it, because you'll be learning your way of doing anesthesia because you're ready to graduate. You will get a minimum of 2,000 hours, as Dr. Jim pointed out. It's more like twice that nationally. A minimum of 700 cases. You're probably looking at 900 to 1,000, sometimes 1,200. Numbers, with total cases, you always got to look at the quality and not just the quantity, So, I mean, if you've got 1,200 cases and you got like 300 cataracts on there, well, that's great, but you're not going to learn much in a cataract. But if you go out of your way to seek out the big cases, the critical cases, the thoracotomies, large back cases, cranies, quality cases, you're going to have a minimum on all these types of cases you're going to have to get, and you'll meet that minimum. But the important thing in clinical is to work hard, stay late, do the extra mile. Because when you finish this program, that is not the end. That's the start of that's the end of the beginning. Because then you got to go out there and you got to actually be able to do it. So the more effort you put in to your clinical rotations, the more you seek out those big cases, the more you seek out those blocks, the more you stay late, the more you get extra lines, central lines, A lines. That's going to make you a better provider in the long run. And that's really going to help you when you graduate. And the scholarly project, Dr. Toons already talked about. So the NCA, so that's your national certification exam. After you graduate, you will be required to pass a national certification exam. That's a exam administered by the NBCRNA. It's imperative. There's data out there from the NBCRNA which shows us the optimal time to take that exam to pass it. And the last time I looked, I think it was about 4 weeks after graduating is the optimal time. So after you graduate, we highly recommend you spend 4 weeks at least studying every day and taking pass that exam. Do I know of people who passed their everything, graduated, got their degree, got the numbers, good to go, waited a year to take the NCE because back in the day you could work as a graduate SRNA before you passed your NCE. They worked for a year and ended up never passing their exam, so they had to go back and work as an RN. So it's really imperative that during, as Dr. Shun pointed out, after you finish your didactics, I say we're on paper integrated program, but we're heavily front loaded. I will be assigning Apex workbooks. That's a learning platform that is very popular in nurse anesthesia. I'll be sending workbooks every week while you're in clinical, which you'll be required to complete handwritten. I'll be giving you exams, and it's really imperative that you utilize these learning our opportunities to the greatest extent. Because if you're not going to go through this course and then take some review exam at the end if you don't and think you can not work for the entire 2.5 years and do a prep course and it's going to get you through it. It won't. What will get you through this course? Day one, hit the books hard and keep going. When you get the clinical, keep studying, keep at it. What the Council on Accreditation considers a reasonable working week is 64 hours. That can be averaged over 4 weeks. That includes your clinical and studying. So that means you could work 80 hours 1 week, 40 the next. Mostly 50 to 60 in my experience. So that's the expectation. But at the end of it, you're going to have a great profession. You're going to have a great life, and it's a lot of fun. Practicing in any setting as a full scope of practice anesthesia providers. If you go to some of the CANA or state organization nurse anesthesia meetings, I know you guys probably don't go to those, or a few of you may, you'll learn about your scope of practice. So we've got 3 of the 5 UCs, I've worked in 2 of them. We've got big trauma centers in Central California where CRNAs are working independently. We're looking at sites in Texas where CRNAs work independently. When you walk out the door, we want you to be able to go and work at any setting you want, not restricted to a team model and not restricted to working in small hospitals. You'd be able to go to any hospital, anywhere in the country, and practice to the full scope of your license. And then a lot of your core doctoral classes, they're preparing you for take the lead in healthcare, practice and policy. Politics controls all. That's another thing you'll learn when you're in the program. We like to go to Sacramento for lobby day, to the state capitol. Everything's controlled by politics. So as a practice, if we do not lobby politically for our practice, our scope of practice, we will lose it. And that's what we're looking for. We want you to take these classes. We want you to go out there. We want you to be leaders. We want you to be active politically and with the National Association. It's imperative to our practice. And to piggyback on to what Dr. June said in the introduction, cultural humidity and addressing health disparities. That's huge in the UC system. UC system is nationally renowned for their adherence to uh, equality, equity, and addressing health disparities. I'm done with this. We can go to the next slide. Hey, Brian, do you want to take this one?
Sure. So the question often comes from other applicants is, okay, so I am admitted into the program, admitted into a program. This really kind of transcends across any program. We recognize that most applicants will apply to many programs, and we're here to tell you why our program is so great. Um, but to the point of this is, how am I successful in a doctoral anesthesia program? There's lots of rhetoric that exists out there, everyone. So all of you that are online, I'm sure that you have heard, oh my God, it's the hardest thing you've ever done. All you do is eat, sleep, and breathe anesthesia, all of these nightmare stories. I've been in higher education, nurse anesthesia education for a long time. It's hard, but is it doable and is it manageable? 100%. Is this like baccalaureate level nursing? No, not at all. This is a big boy, big girl role. And we train you for that. And there's a lot that goes into that, but this is very manageable. Um, pa- Students with families, you can do this. Students that have to work a little tiny bit, you can do this. Students with kids, you can do this. It's not going to be easy, but you can do it. And to do that, there has to be a level of dedication to your studies. You have to know that walking into this, this is a humongous priority in your life. One, because of the expense that you're going to put forward for a program. They're all expensive across the country. Ours is quite reasonable, being in a UC and not a private program. It's very, very competitive. But you have to be very committed to those studies within the program and know that this is your job. This is the central focus of really what you're doing for the next 3 years. And that commitment will transcend all the way through this. And you have to have protected time dedicated straight to this. Am I saying abandon your kids? Nope. Am I saying abandon your marriage? Nope. But what I'm saying is have a very time-focused, regimented plan on how you're going to do the greater part of 40 hours a week of study. So, and then the question always comes up, can I work during a nurse anesthesia program? You can. It's discouraged, and let me tell you why. So in that first quarter, it's a transition phase. If you needed to work, it's fine. Again, I'll tell you from almost 2 decades in nurse anesthesia education, I had some students that they left the ICU and they were like, I'm never going back. I was in the ICU to be here. I'm 100% committed to being here, and I'm never going back to the ICU. I was one of those myself, so I get that attitude. But many of them, um, they need a little bit of financial support. They need to do a weekend shift in the ICU. I get it. So you just have to make sure that your studies are number one. And if there's a big old principles of anesthesia class exam, a midterm, a final, a simulation on Monday, and you're trying to work the weekend before, that's bad, bad planning. This needs to be priority number one. So can you pick up a little bit? Yeah, you could. It's discouraged, but you could. If that's what your life needs you to do. And like I said, year one gives all that foundation knowledge. So you're walking in really with solid exposure of didactic knowledge. And then the long-term focus is I'm walking into a very lucrative career. So you can look online the average for the RNA salaries. This is national average. Looking across is 280 to 300,000. Here in the Central Valley of California, it's about $400,000. So why would you jeopardize a very, very lucrative career for a couple shifts in the ICU? It's just not worth it at all. And so that's the long and the short of it. But at the end of the day, you're adults, you're licensed professionals, and you got to do what you got to do to take care of your family situation and your personal financial situation. But this can be done, everyone. Everyone online, this is manageable. Don't listen to all that rhetoric. If you're committed to this and you want to do this, you can do this.
All right. Thank you so much, Dr. Toon and Dr. Burrows. I always learn so much when I hear our faculty talk, and especially about our DNP-NA program. We're going to switch gears, and I want to be cognizant of time. We are going to go over through some admissions requirements and some of the process. As Amanda put in the chat, if we are not able to answer your question, please go ahead and email us. We'll definitely get back to you. And Dr. Toon and Dr. Burrows, please feel free to jump in. But Amanda, you want to take it away with admissions requirements? I do notice we're getting questions about prerequisites and GPA, so I know you're going to take a few minutes on those. So take it away.
Thanks, Catherine. I'm not actually going to go in detail into all of these bullet points. I'll have Catherine actually link in the chat our admissions website. And so if you have any questions after this presentation, you can go there to clarify, like, did Amanda say it was a 3.0? Did Amanda say it was 3 letters of recommendation? All of this is found on our website. You could also browse the FAQ page as well. We find that that's pretty helpful for our applicants. So going into admissions requirements, obviously our first requirement is an unencumbered license as an RN or a PRN in the US. And then second is a BSN or an MSN. Now there is an asterisk on that bullet point on the admission requirement because you are eligible to apply to this program with an ADN. As long as you have a bachelor's degree also in a different field. So let's say I have a degree in sociology and then went back to school to earn my ADN. It's totally fine. You just need to complete the prerequisites that are listed on our website. For everyone else with a BSN or an MSN, prerequisites are waived for you. So you don't have to worry about those whatsoever. Moving on, a minimum of 1 year full-time experience. We will talk about that in a slide a little bit later. A minimum cumulative bachelor's degree GPA of 3.0, and how UC Davis calculates that. It's actually a requirement from the University of California Office of the President for all UC graduate programs. And to calculate this, we check the overall GPA listed on your bachelor's degree granting institution transcript. So if I graduated 5 years ago from UC Davis as an undergrad, whatever overall GPA is on that UC Davis transcript is what we will consider a bachelor's degree GPA. Moving forward, 3 letters of recommendation and short essays submitted through NursingCast. Please don't submit anything directly to us by email or by mail. Everything in this first step needs to be through NursingCast. Then a select group of applicants will be invited to a virtual interview. So those are conducted over Zoom. And also new for 2025 for anyone that had submitted an application for in 2024. We do have a shadowing requirement that is mandatory this year. That is 8 hours with a CRNA or a physician anesthesiologist. That needs to be done prior to actually submitting your NursingCast application. There's no form or anything that you need them to, that your supervisor or the person you shadowed needs to fill out, although you will be asked to include their contact information in NursingCast so that we could verify your hours. Again, all of this information is on the website, and if at any point you have any questions about the details, please feel free to email us. Next slide, please, Catherine.
Really quickly, Amanda, because I know we get this question a lot, is what about for those who have like multiple bachelor's degrees? What GPA do we tend to look at?
Great question. I think I did see that a couple times in our Q&A. If you have 2 different bachelor's degrees, we will take the GPA that is higher, the overall bachelor's degree granting transcript GPA, like I mentioned earlier. Whichever one is higher is the one we will accept, even if that's not your nursing GPA. Whichever GPA is higher, that's the one we will use to check off that bachelor's degree GPA minimum. Okay, critical care experience. So we are looking for 1 year full-time work experience or its part-time equivalent as a registered nurse in a critical care setting. So that is a total of 2,080 hours. So these hours must be within, I don't know actually if that bullet point is still required this year. That was something that was considered for the previous year. I know that critical care experience is accepted within the US or Canada, but I think moving forward in our admissions cycle, critical care no longer expires. So if you've taken critical care experience, if you've completed it 5 years ago, that's going to be okay. We will still count those hours, although we do recommend to be as strong as possible that your critical care experience is more recent. So that is a preference, but we will accept experiences that are over 2 years old. These are the examples, some examples of experience that we would accept. PACU experience is not considered critical care experience at UC Davis. And then I also like to mention there's no distinction in terms of competitiveness between these like units. So it's not like, pediatric ICU, because you're only working with children, is considered less competitive than maybe like cardiac ICU. All of the critical care experiences on this list, on this slide, are considered equal. Critical care experience during the admissions process is just considered critical care experience. That being said, we do consider acuity and like trauma designation during the admissions process. So, higher acuity or like tier 1 trauma designation, that would be considered more competitive. We will ask you to write about that in your essay section of your application. I know there is a lot of questions about, someone could say like, my unit has a title or a name that's not on this list, or I worked in a hospital where it wasn't as clearly defined. If you have any questions like that, it's kind of on a case-by-case basis that we review. So please go ahead and email us if you have any questions about whether your critical care experience is accepted. Catherine, anything that you wanted to add for that? I did see that somebody asked about, I think it was flight nurse experience. So that was included on the list.
We
Saw
love
that
it.
too.
That definitely counts.
Yeah. All right, thank you. We'll go to our next slide here. And so I also saw a lot of questions in the Q&A about our inaugural cohort demographics. And so we just pulled a couple of statistics and demographics about our current year 1 students. We received an overwhelmingly large number of applications last year, 405. And seated a cohort of 16 students. So that's about an acceptance rate of 4%. That is not to discourage anybody whatsoever from applying to this program. That is just 1 year of data to share with you all. For example, in our PA and our nursing programs, the applications received fluctuate greatly year to year, depending on kind of what's going on in the healthcare world, and how many other programs are being accredited. So please keep that in mind as we kind of go through these demographics. Similar
Amanda,
to
can I chime in real quick on that?
Yeah,
Do you mind?
please.
So just a quick note, everyone, because I know you're looking at that and you're thinking, oh my God, 4% acceptance rate. There's no way in hell I'm going to get accepted to this program. Take a breath. Let me tell you something here. So most of these applicants, the 405 applicants, they put their application in. That does not mean they were 100% viable applicants. They could have had deficits. Their GPA could have fell below the margin. They could have not submitted all their information. They didn't have the ideal qualifications. That's just the amount of applications that came through. So don't be discouraged by that. The second point to this is people apply to a lot of programs. So if you're committed and you really think this is a good fit for you, and you should, this is a phenomenal program, put that application in because students will apply to multiple programs, and it is often the case that they will take or they will accept an offer from another program before they even get to interview with us. So just because we only accepted that small 4%, that doesn't throw you out. There's a high chance, and there's so many other cofactors that you're not seeing here that go into this applicant pool. So don't be discouraged by that.
Thank you, Dr. Toon. And along with that, GPA as well. This is the average bachelor's degree GPA that I mentioned earlier, as well as just the overall GPA that's a GPA that we pull for every college or a university level course that you've ever taken. So from, undergrad to if you have a graduate GPA or have taken courses as like in a post-bac setting. Similar to what Dr. Toon just said, we do review applications holistically. So while we do expect you to be prepared academically and be able to show that, I'm able to pursue this type of rigorous program and be successful. GPA is just a number. It doesn't determine whether it will be a good provider or not. So please keep that in mind as well. Again, these statistics are high, but there's, more factors than just academics during the application review. Our faculty put in a lot of work to review the cohort. And so I wish it was as easy as just selecting the top, 16 applicants with the highest GPA, but the faculty put in a ton of work to review everything that you submit to us. So going down to the next bullet point, average years of critical care experience, that is 5 years. That was the average for the first cohort. And then our cohort also happened to be 100% in-state students, although, out-of-state students are also welcome to submit applications and can be considered competitive applicants as well. So again, this is just the demographics and data that we have for this first cycle, not intended to scare anyone off, but more intended to just be transparent. We do get a lot of questions about these statistics, so we thought it would be helpful to share.
Just one more thing, Amanda, is speaking of in-state and out-of-state, it just kind of, I know there's a lot that goes into the holistic process, but I have some questions in the Q&A. Is that do people in-state have more of an edge? And I believe the answer is no, but did you want to speak to that briefly?
Yeah, I would say that the answer is no for that, although, this program is intended to build up CRNAs for the Davis, Sacramento kind of greater area, Northern California area. That was a charge given to us by the UC system and by UC Davis Health. And so that may be something that we do look at, if you are from this area, familiar with UC Davis and are trying to stay and serve in this area, that may be something that can help. But if you're out of state, that doesn't, disqualify you, or you don't quote unquote lose points in any way. Another thing that faculty may review during the essay review and also interview is, are you familiar with the type of, healthcare issues that are presented in the Northern California or Greater California area, so that, by identifying those types of things that may be helpful for your application. But again, out-of-state students, there's nothing to say that your interview or your essay wouldn't be considered competitive without that. So
Thank you.
okay, so how to apply. This is just a really, really high level overview or timeline of our admissions process. There's a lot that goes in behind the scenes. But for applicants, the application is open right now. It opened in early August and will continue to do so the first or second week of August moving forward for the foreseeable future. Applications will close on November 1st. If you take one thing away from this information session, it is that please have it be that our applications close 11:59 p.m. Eastern time. Nursing Cast, their headquarters, I think, is in Massachusetts, even though we are a Pacific Standard Time school. The deadline that Nursing Cast will set will be Eastern Time. So please submit your application before then. Actually, you must have a complete or verified status by this time, so it's not enough that you just submit and pay for your application. We will also need your transcripts and letters of recommendation in by that deadline. All right, and so moving on to the next step. After November 1st, our faculty will be working very, very hard to review all the good things that you've sent our way. And then in late January, early February, a select pool of applicants will be invited, I'm sorry, to interview. And those interviews will take place late February, early March. And then those that are asked and RSVP for an interview, you'll also be asked to complete a secondary application through UC Davis Graduate Studies. And more specific instructions on that secondary application process will be sent out by email during that time. Two things that I want to mention during this time period. Please don't submit a secondary application unless instructed to or invited. It will not be reviewed. You will have to pay the fee and your application won't be considered. And also, there is going to be an interview waitlist. So some applicants may be invited to interview and complete that secondary application maybe at a later time. So maybe late February or even early March, right before the interviews take place. And so if you are waiting to hear back and you're like, oh, I didn't hear back by early February, I must be denied. That's not the case. We do have a interview wait list. Like Dr. Toon mentioned, some applicants, they get into a school that they're interested in before even going through the interview process at UC Davis. So please keep checking your email during that period of time. Then offers of admission will go out in late March. And then the first day of summer quarter is typically late June of each year. Applicants can be denied by email at any point in this cycle. So there's typically not a specific day that all the denials go out. It's kind of step by step or on a rolling basis. But we will get back to every single applicant by email throughout the application process. So if it's like March and you haven't heard anything from us, please shoot us an email so we can check on the status of your file.
Before you go on, Amanda, I do want to be again cognizant of time. We're right at 6:30. We have probably about 10 minutes left or so, and I do have, I think, one or two themed questions that I will bring to our faculty at the end, so just hang tight. Again, this is being recorded, so if you're not able to stay, you will get the recording. So I just wanted to point that out. But Amanda, continue with Kath.
Thanks, Catherine. I also wanted to just quickly go over Nursing CAS. Nursing CAS is the application system for the initial application system for our program. Nursing CAS stands for Nursing Centralized Application System. Some of you may be familiar with it. Some BSN programs accept applications through Nursing CAS as well. For those of you that are not familiar, it is kind of like the undergraduate common application or even the UC system application for undergrads, where you complete one general application, and then for each school that you add on, you pay a fee for however many schools you click to submit for. So a couple things here. The process is quite complicated. I really recommend reading through the Nursing CAS Applicant Help Center before you actually get started. They have a great quick start guide as well that a lot of applicants find really helpful. So please go directly to the Nursing CAS website to look for that. Any technical issues that you run into, please also contact Nursing CAS. They have a great customer service team that can kind of navigate and see what's going on your end. But a couple of things that I wanted to mention that I think a lot of applicants skip over. There are not going to be any changes after submission. So if you are adding information, if you're wanting to change something on your essay, unfortunately, once you submit, we're not able to change that for you. The second bullet point, which is really important, is be thorough. Please don't leave prompts blank. If it's there, it's because we want to know about you in that capacity. So many applicants leave the experience section just completely blank, and so we're not allowed to kind of, we're not allowed, but we're not able to kind of look through your employment history and things like that. Something else that applicants frequently forget to do is input their supervisor contact information, direct contact information. Those types of things are really important as well. So please pay close attention to details, be mindful about not leaving anything blank, or make sure you go back right before submitting to make sure you've added everything in. PTE. PTE stands for, I never remember. I think it's
Professional Transcript Entry.
Thank you, Catherine. Professional Transcript Entry. This is a service that Nursing CAS offers to applicants for a fee. All applicants will be required to submit their transcripts and also input their coursework as part of their application, course title, course grade, number of units, those types of things. And so Nursing CAS offers a service where they will do that for you. Please go to the Applicant Help Center and read through that timeline so you're familiar. If it's approaching the deadline, if it's maybe 3 or 4 weeks out from the deadline, we do not recommend utilizing PTE. Your application will not be marked complete until Nursing CAS gets to your application. So you're leaving the timeline and you're leaving the completion of your application in the hands of someone else that doesn't care about our deadline. So please read through that information. And if you're going to use the PTE service, please submit your application early enough for that. Finally, just know that I mentioned this before, Nursing CAS has really great resources on their website. Please review them. We're not able to make exceptions to our admissions policies or our review timeline because of errors when it comes to Nursing CAS submissions.
Ooh, I think we're at the end. Let me double check.
I think so too. Yeah.
Great job, everyone. So thank you all for joining us today. I know, again, we're a little bit over. I do have a couple of themed questions I do want to give our panel, and I'll go right into it. So Dr. Burrows, this is for you. Dr. Chun, you can chime in as well. There were some questions received more about how clinical placements occur. I do know you mentioned throughout the information session today, they could be in-state, out-of-state, but can you go over a little bit more about like overall how that process works?
Yeah. So with clinical placements, in order to graduate, there's a certain amount of cases you need to get a certain amount of neuro, cardiac, peds, peds under two, peds above two, etc., etc. And not every institution has those specialties. So your clinical placements will be based on the concept of getting you the best clinical experience to make you a well-rounded full practice provider. That would be our focus when making the clinical placements. It won't be where you live or that anything like that. It'll be making you an excellent provider. So you may be required to go to Texas, may be required to go to Arizona, depending where our clinical sites, because that's evolving.
Thank you. Dr. Toon, did you want to add anything to that?
It probably is worth noting that the vast majority of our sites are in California, and Dr.
Yeah.
Burrows works hard to try to keep everyone, we're committed to California and taking care of the needs here. But as he said, if you need hearts and we can't get them here because it's full or there's political issues or whatever the case may be, you might have to go to Texas. But we really do try to
The way
focus
it's looking at the
here.
moment, for the first cohort, they're probably all going to have to go to Texas. Now that may change when as we expand our clinical sites and get more, but it cannot be guaranteed.
Thank you. Amanda, I have one for you. I know you did a great job going over multiple BSN, degrees and GPA. We did get a few questions about having maybe a lower bachelor's degree, but a higher MSN. Can you speak to that a little bit?
Yes, if I can find my unmute button. So a master's GPA does not replace a bachelor's degree GPA when it comes to looking at that minimum requirement of 3.0. Again, that bachelor's degree GPA minimum is set not by UC Davis, but University of California Office of the President. So it's something that we kind of have to check off our list during our review. So MSNs are reviewed very heavily. We do look at that coursework. We do look at the GPA that you get from that, and it could be very helpful. However, it doesn't replace or override a bachelor's degree that is lower or maybe doesn't meet the 3.0 at all.
Thank you so much. Again, I want to be cognizant of time. We're about 10 minutes over. Dr. Toon, Dr. Burrows, Stephen, Amanda, do you have any last remaining thoughts before we say good evening to our group? And for those, again, if we didn't answer your question, please email us. Amanda, if you can put our admissions email back in the chat again, we will answer your question. We pride ourselves on that. But Dr. Burrows, Dr. Toon, anything to add?
I get a common question about what can I do to really stand out? And so I think when we're looking at a large volume of applications, the students that are really going to stand out, we do look at that GPA, obviously, we got to look at your academics, but we care a lot and it helps us to clearly see what the picture is when your resume or your CV is very clear, it very clearly highlights your critical care experience. And we also want to know that you're doing other things. Um, we want to know what other kind of leadership activity things that you're involved in and how have you really engaged in the healthcare system. Those things kind of help sit you above. If you don't have the CCRN, get the CCRN. That is one other big kicker. And it really kind of gives you extra points and you want to make sure that you're able to show, look, I passed the standardized exam. Does it make you a better ICU nurse? No. But what it does is it tells us as a committee, hey, I can pass the standardized exam on advanced concepts within critical care. And so that's valuable to us. So those would be kind of my tips for you. And make sure that you're coming from and highlighting your critical care experience. We want to know that you're coming from high level ICUs. If it were, small, rural, critical access ICUs, do is probably not in your best interest, meaning you want to have high level ICU experience because we start day one at that level and move forward. So if you're sitting down here and you don't have that critical care knowledge, it puts you behind from day one. So really do a self-assessment of that on yourself and highlight it in your writing and tell us about your critical care experience. Terry?
Just to clarify for the clinical, as Dr. Jim pointed out, the vast majority of our sites are in California. It's northern, central, and we're getting more in Southern California. And north, as I say, we're looking at some rural rotations up Northern California as well, north of Sacramento. So while there's a very solid chance you're going to go out of state for a rotation, maybe two, the vast majority of our sites are in California. But it's not likely you're going to be able to live in the one, like if you say live in Davis, you want to stay in Davis for the entire program. That's not doable, but that's not doable in most programs. In this day and age, a lot of programs rotate out of state to different places to get the required numbers. So we're not really that much different from other programs in that respect.
Yeah,
Thank
there are a
you.
few programs that don't have to do out rotations
Yeah.
unless you're hospital based. And the reality, in my opinion, if you're a hospital based program, you get one exposure to one kind of and one style and one practice environment.
Yeah.
And I'm not sure that that's the best
No.
graduate. You want to have all kinds of exposures to be able to decide where you want to go and what kind of work you want to practice in and what kind of practice environment you want to be in.
And even if I've worked in two UCs, UCSD and UCSF, and you've got so much money, so many drugs, so much excellent equipment. If you go to Central California, they don't have that kind of money because the payer mix is different. So when you're going down to Texas and the border, if you're going to Central California compared to San Francisco and Los Angeles, you're going to see a different method of anesthesia because your payer mix is going to dictate sometimes the type of anesthesia you do. If a hospital is getting a lot of Medicaid, pet Medicare paying for their services, they're not going to be able to afford every fancy drug like some of the big teaching hospitals do. So there is definitely something to be gained from going out of state and from doing rural rotations.
I always learn so much. Thank you both for all that additional information. Amanda, you have anything else to add?
Um, I think one thing that also separates, going back to, what might separate a competitive applicant from the group is familiarity with what we at UC Davis School of Nursing, what we're all about. And so the information, I think Dr. Burrows mentioned at the very beginning of this session, about our school's mission and vision, about our program goals, those types of things. I think being able to comfortably relate that to your own personal goals and interests in your essay and your interview, that is also something really helpful. And it allows us to see like, oh, you're not only interested in pursuing this type of profession, but you also are applying to this particular program for a reason. We're looking for great future CRNAs, but you all should also be looking for schools that help you get to where you want to be in the future as a CRNA. So thinking about those types of things, being able to express that in your essay, being familiar with our mission and vision, I think can be helpful to have a standout application as well.
We just didn't put it in there just because you should know it's important to the admissions process.
Yeah, yes, for sure.
Awesome. Well, again, thank you everyone for joining us this evening. Again, special thank you for Dr. Burrows, Dr. Toon, Amanda for joining us today. Again, registration for the in-person information sessions will be up next week, and have a good evening, everyone.